Have you ever stopped to think about how health breakthroughs become commonplace treatments? Like, really thought about it? What does it take? What experts need to be involved? What role do not-for-profit and industry partners play? And how do healthcare systems, patients, and their loved ones shape what works and what doesn't? Collaborative Endeavors is a podcast about how experts from different areas of research come together to tackle big health challenges, leading to better therapies and healthier communities. Join me, Lauren Rieger, as we meet transdisciplinary research teams from a range of academic and non-academic backgrounds, all working to improve our physical and mental well-being and community vitality. Hosted by the University of Illinois Chicago's Center for Clinical and Translational Science, Collaborative Endeavors breaks down the complicated translational science process to show how everyone, yes, even you, can contribute to a healthier tomorrow.
People are afraid. And we talk about that fear also. We address that as soon as we start. And we address it when we end. And we said that it's okay to be afraid. You can be courageous and afraid all at the same time. And the important thing is that we're all here and learning this.
Welcome to Community Level, the podcast where public health research meets real-world impact. Brought to you by the Community Health Sciences Division of the University of Illinois Chicago's School of Public Health, we bring you real conversations with researchers, practitioners, community leaders, and organizations working to create healthier communities. Let's dive into today's episode.
Hello, everyone. Welcome. You are on the Community Level. My name is Dr. Kelechi Bay-Lamberts, and I just have to say, I am so happy for you to be here, for us to be here. This is the official first episode of the Community Level podcast brought to you by the Community Health Sciences Division of the School of Public Health at the University of Illinois, Chicago. Again, Dr. Kelechi Bay-Lamberts. I serve as a clinical associate professor in the Division of Community Health Sciences, but I, more importantly, serve as your conductor, your navigator throughout the course of this season for this particular podcast. And yes, again, this is the inaugural episode, so the introduction and the overview is going to be a little bit more detailed, but I'm very excited. We have a great show for you coming up. We have a great guest that I'm going to be talking about, just bringing everything to the forefront. But first, let's just get into what is the Community Level. And this is a podcast that is meant to be able to bring together community, scholarly, practice, all things that are pertinent to community and public health. We are bringing it to the same level. We want to be able to make sure that we can bring to light all the great things that our scholars, that our practitioners, that our students, that our community members are all doing. We all want to meet on the same level. We all want to be able to share and discuss and have real conversations about the work that we're doing and why we're doing it. So a little breakdown on how this show kind of works. So there are two components to this. The first component is that we have our guest provide a video. So we do have a video upload that guests will usually watch on our YouTube page, and that gives you an opportunity for you to see a little bit more of the formal part of the work that our guests usually do, learn a little bit more about that. You also have an opportunity to be able to leave comments and ask questions so that our guests can be able to answer them for our Q&A sessions. I'm saying all of that. This is our first episode, so we do not necessarily have the Q&A, but we do hope that in future iterations, we will be able to do more of a Q&A session to answer your questions based off of what you ask in the video. Then the second part of it is here, where you're at right now, where we have true, in-depth human interest stories ultimately, right? Like we're going to have great conversations about the origin and the drive behind the work that each of our guests are sharing with you all. And so we want it to be an opportunity for us to be able to translate community health work, community health service, community health information so that everybody can be able to meet and interact and collaborate, if anything, on the same level. We can all be on the same level and understand, and that is the community level. Because for us here at UIC, we are about the community. We are about servitude. We are about making sure that we can be able to do the work to be able to reach the communities and reach the people that have been overlooked, underserved, marginalized. But we also know that there are amazing people doing amazing work in the community, and we want to bring them here. We want to share their stories, not just their work, but we want to share their stories with you so that you all can be able to appreciate and understand it. So that's where we're at. That's where we hope to go. We intend to, this season and the seasons beyond, we hope to be able to at least give you episodes on a monthly basis. So we will have some things that are queued up for you. So we hope that you'll be able to listen and we'll be more regular. So please be sure to follow us at UIC Community Health Side. That is our Instagram page, and we're also there on LinkedIn and Facebook. So you'll be seeing more information about us as we continue to grow and move through it. Also, want to give a special early shout out to my production team. Want to give a special shout out first to the faculty for just being able to support this, and the School of Public Health and this Division of Community Health Sciences specifically. Shout out to Dr. Ben Shaw for putting this out there and giving me the thumbs up and the encouragement to be able to do this and lead this show. So this, again, my production team, want to give a shout out to Sabrina, want to give a shout out to Caroline, to give a shout out to Dan Mesler, give a shout out to Julie. I mean, just this actually, full transparency, this is a class. Like, this also serves as an independent study for some of our students who are very interested in health communication and just doing health media and health production. So this is also an opportunity for our upcoming stars, right? Our upcoming professionals in public health who are interested in doing more of this work. This is an opportunity for them to grow and develop as well. So amazing times ahead, great things to do. Very, very excited. I cannot just stress my excitement and just all the great things that are in store this season 1 of the Community Level podcast. Okay, so now that we've gotten all the introductory plans and the vision and the goals for the podcast out the way for you, I want to introduce our first guest. Yes, our first guest ever here on Community Level, Miss Martine Caverl, who is the executive director of Ujimaa Medics, also known as Medics, based on the south side of Chicago. She's let me read her bio. I want to read her bio. I just want to let you know that usually as I introduce the guest, I'm going to read the bio and then we'll get into the interview. So Miss Caverl is currently the executive director of Ujimaa Medics, but she's also a registered nurse and certified case manager. Martine integrated years of experience in grassroots community, youth, and international solidarity, organizing with her nursing, street medic, emergency preparedness, and birthwork skills to develop the Black Health Collective that became Ujimaa Medics. In 2014, she started teaching community care responses for gunshot wounds with fellow organizers in Chicago. And in 2015, they founded Ujimaa Medics. Today, she is executive director and is grateful for the opportunity to build a future for this organization that she loves. With the help of family, mentors, and trusted comrades, Martine has completed 20 hours of community emergency response team training through the city of Chicago, became a level 4 outdoor leadership instructor with Black Survival Network. She graduated, like I mentioned, from New York University and Johns Hopkins School of Nursing, and currently she's a registered nurse and also certified case manager. Her practice encompasses public health, healing justice, and organizing the power of care networks. She stays inspired by legacy she inherited from her ancestors and the one that she will leave behind for her daughter's generation. The word Ujimaa stands for collective work and responsibility. And this was something that resonated with me as I was preparing for my conversation with Martine. And as we jump into it, I want you all to join me in this conversation that I have with her. And I know I've done a lot of talking, so we'll stop here and we'll bring Martine on to join me on a community level. Let's get into it. Hello, everyone. Welcome. Thank you for joining me on a community level. And so we are very fortunate to have our first guest, Miss Martine Caverl, who will be joining us and talking about Ujimaa Medics. So, Miss Caverl, thank you so much for joining the show. How are you today?
I'm very well. Thank you so much. How are you?
I'm doing well. Again, you are our first guest. So we about to make this a good one. Really want to learn a little bit about just what Ujimaa Medics is, and for our listeners, just knowing a little bit about all the great things that you're doing. But before we even get into Ujimaa, I want to know about you. Like, tell me your origin story. Like, how'd you even get here?
Okay, you make me sound like a supervillain.
You are no superhero, heroine. Like, come on, sis. Yeah,
superhero origin story. That's all right.
Yeah,
you know, as long as it's an interesting story, right?
Yes.
So I am also from Chicago, and so I was looking at your bio here. And I am the youngest of a bunch of kids. And I am a person who has, for a long time, been thinking about what is my contribution to my family, what's my contribution to my community, what's my contribution to planet Earth, and what are the things that I can be doing that perhaps if I did not do those things, they might not get done. They might not get done in the way that I could do it. So what is my unique contribution? And so that's what I've been on a mission to do since I was very young. And for right now, in the year 2024, my mission has me being the executive director of Ujimaa Medics. Before that, I was doing nursing work. I was doing doula work, birth work. I was a community organizer. I was a friend, an auntie, a wife. I became a mother after Ujimaa Medics, and a granddaughter. That's really important because I think that part of the reason I was drawn to do the kind of work that I do is because of my family's legacy and the kind of people that I come from that raised me and make up my lineage. And so, for example, it wasn't until after I started Ujimaa Medics and after I'd gone to nursing school and after I started doing birth work that I learned more about my grandmother, my mom's mom. She died when I was still, was I in high school yet? I don't think I was even in high school when she died. And so I didn't get a chance to really talk to her and have adult conversations, where I'm asking questions about, who are you really? And, what advice you have for me. So I had to learn from her, about her, from other people's stories about her and just my memories and observations. But she was what people now call a postpartum doula. And so that means that I think she would have just called it missionary work. She was a person in the community that was looked at as a leader. Her and my grandfather both, they were very much into what we may call a form of community development, community organizing, community togetherness. And the pathway they saw to do that, to achieve that, was through the church. So they would like to found churches and organize camp meetings and all these ways for people to come together, get to know each other, make connections, collaborate. And also that was a mechanism by which people were able to identify needs in the community. We could figure out who was sick, who was hungry, who was having a baby, and, organize that support through the church. And so that's what my grandmother would do, is she would go and visit families that had recently had a baby and make sure they had what they needed and organize support for them. And my mother likes to say that she didn't really like that because she was forced to wash dirty diapers outside. So that wasn't fun for her. Yeah. She didn't wind up doing anything like that later. But, I guess I picked it up myself. And she talks a lot about how her parents, and actually more like my grandfather, her father, had a lot of knowledge about how to treat illness and treat injury. And, but, without going to the hospital, without going to the doctor. And that was important at that time, especially because this was in rural Mississippi. And the medical system was hostile to our community. And so they didn't, trust, their bodies with those people. And so they found ways to help each other and lean on each other. And that's what we do, right? So we're not in the exact same situation as they were then, but we are still dealing with health disparities in our communities. We're still dealing with racism, the medical system. We're still dealing with um, different forms of violence, and we're still dealing with a need to achieve peace and justice and wellness in our communities, Black communities here, around the country, in the U.S., and definitely around the world. We're facing similar issues with this. And so um, for me, I believe that there's a lot that can happen on all levels, from individual choices to choices that happen at the level of a network of care, friends, family, neighbors, up to the institutional level. So, I hope that the work that I do ends up addressing all of those. That's a little bit about me, but I could say more.
No, we're gonna definitely get there. And now I definitely don't put any blame on your moms. Those diapers will do that to you. They will have you rethinking. I got my kids. I definitely know that some of those diapers, if you have to wash them and oof. But I think I want to know. So you mentioned the work that you do. Can you tell us, being the executive director of Ujimaa Medics, like, and I know Ujimaa, comes from the term, the Swahili term of collective work and responsibility, right? And so I want to know the work that you're doing there, and how you're going about continuing to build that collective effort and responsibility in the community, as you described earlier, driven from your mom, I mean, your grandma, and how you've taken on that mantle and you're doing the work that you're doing.
Yeah, thank you. So the work that we do. So I'll give our mission, and thank you for bringing forth that meaning, that collective work and responsibility meaning. We take our name Ujimaa from that Kiswahili term, and the third principle of Kwanzaa, that means collective work and responsibility, and we just add an A onto it, two A's versus one A on the very end of Ujimaa Medics. And that really does characterize what it is that we believe we want to not just develop, but recreate. We believe that there was a point where that was a normal part of Black life, and that a lot of what we're doing isn't, some of what we're doing is creating new structures and new practices, but a lot of this is reclaiming what is ours, and we just have to remember. And there's ways that we can practice that memory in what we do every day with each other, for each other. And so our mission at UMedics is we spread emergency and community care, first response skills, survival skills, and we do that with the intention to access health justice and long-term wellness for all Black lives. That's our work. And so the main way that the community interacts with us in our programs is through workshops. We call them Skills Share workshops, mainly because many of the people who run the workshops are the peers of the folks who come. So it's not like, even though I am a nurse, it's not like you are coming to get information from a nurse about health. It is you are coming to get and share and spread information about health and well-being, and to learn skills from people who you are and should be in community with. That's more of the approach. Okay. And so the types of workshops that we offer include gunshot wound first response, asthma community care. We've done workshops about seizure, diabetes, all community care response work. We do CPR, AED first aid, as far as learning the skills, but we can also certify people. We do protester health and safety for people who want to engage in direct action and political action, and doing it more safely. We do, we train and dispatch street medics. We also recently developed and launched a workshop in collaboration with the Chicago South Side Birth Center called Birth Emergency Skills. And so these are the types of workshops we offer. This is what people come to us for. And the workshops that we offer, we develop them all in-house. And so we really lean on the expertise and genius and experience of people in our communities, people in our membership, people who give us feedback on our workshops, people who tell us what's important to them to develop the content. The first workshop we did was gunshot wound first response. That was a catalyst really for the organization. And that started about 10 years ago, June 2014. I held a workshop with family and friends in my living room, and we taught each other what we knew about how you deal with treating a gunshot wound. I taught what I knew, and it really was a family situation. There were children there. There were older people there. And from there, we spread it out to the community. October of this year makes 10 years since we did the first public workshop where members of the public could come to learn gunshot wound response. And that workshop that we did 10 years ago grew into what we call our basic gunshot wound first response workshop. We have a basic and an advanced. In that basic workshop, we assume that you may not have professional equipment, trauma kits, fancy stuff available to you if somebody gets shot and you're there and you got a lot of choices to make, right? You might not be able to get to that trauma kit. So what do you have in your pocket, in your purse? What does somebody else have in their diaper bag, in their wallet? What can we use that's right there available? What can we improvise to help to extend that injured person's chance of survival? What can we also do to reduce the impact of emotional injuries on everybody, including the witnesses? And then what can we do to keep ourselves safer? And how do we interact with the systems that come down on that scene, from 911 to police? How do we deal with those in a way where we're safer and that person has an increased chance of survival? And then what are some basic principles we can say as it relates to safety values and first aid that can be applied to any emergency you may encounter? How do we do it in a way that's interactive? How do we do it in a way that feels real for the situation that Black people find themselves in Chicago? We developed that workshop with Black medical professionals, people of color working in ERs, and paramedics and farm safety instructors and community organizers and educators and youth. All those people put something into what became that workshop. And so that's the one that is still the most popular offering. People are always asking for it. And it makes sense that they will be asking for that one because, people are afraid. And we talk about that fear also. We address that as soon as we start. And we address it when we end. And we said that it's okay to be afraid. You can be courageous and afraid all at the same time. And the important thing is that we're all here and learning this, whether or not people end up needing to use the skills that they learn in the workshop. And sometimes they do, and sometimes they don't. As far as the hands-on first aid part, we want people to walk away with is that community care approach and some kind of belief in and trust in people in their community that we all want to see this be better, and that someone is likely to help you, should something happen, because we're spreading this training out. So one misconception about medics is that people are calling us in an emergency. And that's not what we're actually trying to do here. What we're trying to do here is give people the tools to help themselves in emergencies.
Right, right.
That's what we're trying to do.
Right. So now I got a question, right? Because you just laid out some really good information, and you really capture the essence of what it is in terms of collective, right, like work, in terms of what can we do together to be able to help each other when the resources, the primary resources aren't available. How can we be resources to each other, which I think is really dope. And I want to, but one of the things that I want to do for the education of those who are listening that may not necessarily always be familiar with Chicago or just what the communities in which you all serve, the idea of a street medic, right? Like that in itself, I think sometimes has a negative connotation to it because of preconceived notions. And when you associate something with street nowadays, there tends to be this assumption, right, that it is something that is something that's nefarious, something that's bad, right? And so I want you to, if you can, just kind of enlighten us about what a street medic is and some of the things that come into that, and why training them is crucial for the work that you all are doing. And then, just a little bit more about that.
Okay, sure. And that's an interesting point you make. I didn't it didn't occur to me that someone would view that as with a negative connotation for those reasons. But perhaps that's because I come into it knowing kind of what it is that we are and do. Right?
Right.
A street medic. So street medic is a term that's been around for a while. It describes a person who has some kind of training in how to give first aid, how to give health response, how to give some kind of protective skills, to offer that to especially people who are involved in political action. And the reason why it's associated with political action is because what we know as modern street medics have origins in the civil rights movement. And, many of us are familiar with stories and footage and images of people marching peacefully and being attacked by police, being attacked by dogs, being attacked by counter protesters. And a lot of people got injured. And it wasn't like they were just out here, unprotected all the time. When you had a protest that was pretty well organized and well resourced, for example, I think the March to Selma especially had people on hand who were essentially street medics. In the beginning, a lot of those folks were medical professionals or medical students as far as civil rights goes. And then over time, it became very important to develop a way for lay responders. So by lay responder, I mean somebody who doesn't have a state recognized certification or license to practice a certain medical discipline, but we can still get people trained with enough skills in order to respond to that type of setting. Street medics are trained as it relates to how do you apply first aid skills, particularly in a situation where it's not just an injury we're dealing with, but we're also dealing with a street situation. We're on the street, we've marched, we've protested. Somebody is, sitting in an intersection, or, there's a potential risk of attack by police. There's a potential risk of attack by counter protesters. So how do you give first aid, and how do you give care in the context of all of that happening? And so that kind of skill set is transferable to a lot of situations. At Ujimaa Medics, even though we do train people on protester health and safety and protest defense, our approach is really community medics. We're mostly concerned with what happens on a regular day,
Right.
in a regular neighborhood, and again, there's multiple kinds of violences that we are addressing in our work. But again, these skills can be kind of transferable from one setting to the other. And so, for example, the average person who says they're a street medic and makes themselves available to help, let's say at a march, they have had at least 24 hours of some kind of basic training as it relates to giving first aid, working in partnership with other street medics about how to communicate with each other, how to coordinate, what to look for, how to triage, and then how to transfer care where necessary and appropriate. And so street medics range from medical doctors to, people who are EMTs, to people who have maybe a CPR, AED first aid certification, to people who were organizers of marches and realize, I would like to get this training too. And so what happens ideally is you have a chain of collaboration on the street where people of different disciplines are working together to create better safety for folks who are out there. Now, street medics do other things too. Another way you can apply that word street is you have people who go out at night or go out during the day. Maybe they have a van, maybe they have a truck, and they drive around and, they post up and they reach out to people who are unhoused and living on the street, and they reach them with medicine and they reach them with care. That's another way that people interact with that. Maybe they have, especially, they might do foot care. They might do needle exchange. They might do COVID testing. They'll do these kinds of things. Or just ask people, what do you need? And let's try to figure that out, right? Maybe you need some clothes. Maybe you need some toiletries. Maybe you need some over-the-counter medicines. And some doctors are able to go out on duty and help, a nurse practitioner is able to go out and help prescribe medicines to folks who aren't going to walk into the clinic, right? Instead of waiting for you to come to the ER, we're going to come to you.
Right.
So, you have folks who do that kind of work. And you have people who do pop-up clinics. And you have people who do disaster relief. A lot of street medics are involved in the disaster relief. You're going to find a lot of street medics who have experience at protests in Western North Carolina right now, doing the kind of relief work that perhaps entities like FEMA are not doing. So, those are all the kind of contexts you're going to find street medics in. And the thing about it is, people who be attracted to get that kind of, they bring all kinds of skills and backgrounds with them, So even though we can trace this idea of street medics back to civil rights, currently you find them all over the world. And definitely there were traditions of care and traditions of emergency response that existed outside and beyond what came together in the 60s that people were practicing because they had to,
Exactly.
right?
Yeah.
And bringing whatever traditions they had with them. Definitely, I know that's true of African American communities here in the United States. So, yeah, I guess other thing about that is I think you saw a big resurgence of interest in street medicine in 2020. And I noticed there was a lot of media coverage about it. And I don't know, I'm not sure which year all the anti-government protests kicked off in, was that Hong Kong? It's Hong Kong, right?
Yep.
So there were a lot of street medics doing some innovative stuff in Hong Kong at that time. People were watching that. A lot of street medics have been in conversation with people in Palestine for a long time about how they were able to help each other with, the poor access they had to medical care. And so there's been a lot of just conversation and collaboration cross communication, sharing of information, um, happening within the U.S. and within North America, and definitely like internationally.
Yeah. So like, what you all have done over 400 plus like workshops already, right? I think I remember reading since
Oh
2018.
yeah.
Yeah, you all have done
Oh
a
yeah.
lot, right? And so what continues to drive these workshops? I know you kind of talked about people coming in and wanting to do it out of fear, but you all it's growing. It's growing. You all are engaging. And so, what continues to drive this, and what are your hopes for 2025 and beyond?
Mm, thank you. I really appreciate you bringing that up. And I definitely believe that fear is the reason why the gunshot wound trainings are the most asked for.
Right. But y'all do more than that.
Although,
Y'all do more than
say
that,
that
right?
again?
Yeah.
Yeah, we do more than that. But those are the most, that's the one that's the most asked for.
Okay.
But as far as what gets people in the room,
Mm.
especially people who see a flyer and show up,
Mm-hmm.
I don't think that is fear
Mm.
all the time. I think it's, I really hope this doesn't sound corny.
Nah, nah.
I really hope it doesn't, but I, based on what happens when people get there, I think it's hope and excitement.
Mm. Nah, that's not
You
corny.
know,
That's real. I think that's
yeah,
real. I think that's powerful.
yeah, it really is
Because I think
because
people. Sorry
go
to,
ahead.
because I was gonna say, I think people sometimes. I don't necessarily think the idea of hope should be corny, but I do think
Mhm.
that people tend to not understand how many of us out there are hopeful, right? How many
That's
of us
right.
are excited, because it's not something that I think we get exposed to nowadays in so many different platforms, that there are a lot of people that are actually very hopeful about tomorrow, and it may not necessarily seem like it all the time. So I'm not surprised by that, but it definitely gives me hope to know that other people are hopeful about what you all are doing as well.
Well, I appreciate that very much. So really, and I hope you come to one soon. But anyway,
Oh yeah, say less.
seriously, I think I think what happens is that they are the I some okay, I'll give you an example. I
Okay.
went to this event a few years ago. This might have been, I think it was 2019. And it was actually a point where I was feeling kind of burnt out.
Mm.
I was feeling burnt out because at that time, so I mentioned that I'm the executive director
Yeah.
of Ujimaa Medics.
Yeah.
So that sounds like, oh, this is a nonprofit organization. They have staff and maybe a building. It
But you also a
makes it sound
nurse, right?
bad,
Like
right?
you're a nurse and you're practicing that too, or did you give up one for the other?
Yeah, so about that. So when we started Umedics in 2014, I was a practicing nurse.
Mm-hmm.
I had a job, full-time job,
Mm-hmm.
extra full-time job.
Extra full
And
time.
then after work and, you know, on the weekends, if I wasn't working the weekends, I was doing Umedics with the other people in the organization. All of us were volunteers. And we were all doing it when we weren't in school
Mm.
or at work or doing other things. And in 2019, it was starting to wear down. We had been busy, busy. I'm telling you, we did
Mm-hmm.
so much work. And I was feeling like, I don't know how much longer I can sustain this. And I go to this event. I ended up getting an award. These wonderful people gave me an award. And I get to the award ceremony. And all these people who I'd actually never seen before, but they knew about Umedics and they knew about our work. And some of the reason I had not seen them before is because they had not actually been to a workshop or an event. They just loved the idea that someone was doing this.
Mm.
They loved the idea that people they knew were coming to the trainings and taking it seriously and talking about it and talking to each other about what do we do in emergency? What can how can I help you? Hey, I know more about asthma now. I can help you with your kids. You know, those kinds of conversations were happening. And even though they'd never been to a program themselves, they just loved that we were doing it. And that was very motivating
Mm.
to me.
Yeah.
And, we kept going. And eventually in 2022, I was able to leave my full time job and start working for Umedics. I consider Umedics to be my public health, community health nursing practice. So I'm still a registered nurse. my nursing work is through Ujimaa Medics. And so that part I think is really significant, that people just want to know that um, so many people in their community are trying to address this, working on this, and that they might be actually surrounded by people who are feeling a little bit more prepared because of their interactions with each other at a medics workshop. Is great.
So a couple more questions before we wrap up. The idea of, well, let me phrase it like this. When you're describing, as you're describing you medics and all the great things that you're doing, right? And there's so much happening, especially when we talk about gun violence and things like that. But what are some challenges, right? Well, congratulations on your award, but like, what are some of the challenges that you had to deal with and overcome? Because it's 2014, we're talking about 10 years now, right? Like, happy 10 years to what you all are doing. But like, what were some of the challenges that you all had to overcome, and what are some challenges that you all are still facing now?
Yeah. So, um, some of the challenges as far as organizing the work itself were definitely like resources. When we started, we didn't have any money. And again, that was another reason why we just started grabbing stuff we had around the house and saying, let's figure out how we can use this to treat a gunshot wound. And so money was an issue. But we figured out how to continue to do the work without money until eventually people started taking notice and started giving us money. It was great, but we didn't have any money at first. And money is still sometimes a barrier between what we dream of being able to do and the impact we dream of being able to have and the ways that we want to add on and expand and what we're able to do. Especially if you just consider that our mission involves sharing skills out with so many people, that we are transforming how Black people experience their health and wellness and sense of justice. Yeah. And the justice part is really important because we're dealing with a situation where we have these health disparities in all these areas, from maternal health and mortality to people dying early, life expectancy, to diabetes, to HIV/AIDS, to heart disease, all these disparities, right? And so sometimes it can be overwhelming thinking about all the full spectrum of skill sets that someone should know just to care better for their loved ones, just to care better for their family. And sometimes we get a little overwhelmed with, okay, should we be doing more? And what is that more that we're able to do? And what is a topic that we're not teaching that we need to start teaching? And that's definitely a challenge. Another challenge too is related to what happens when someone who comes to a medics workshop actually tries to apply their skills in the real world. And in a situation where it's seizure or asthma, you don't have the same problem in terms of the police interaction, although police do sometimes show up for medical. This is what we've been learning. They show up for medical situations where there's no need for them to show up at. But when someone actually tries to help a person who's been shot, has been to a workshop, a lot of times they are unable to access that injured person, or they're unable to continue their care of the injured person because they're disrupted by police. And so that's something that we're finding out by talking to people who've come to our workshops. And that's something that's even some of our members who teach it have encountered when they have tried to apply their skills. So there's some challenges as it relates to, there's some systemic challenges as it relates to, now I have this training, can I actually use it to help save somebody's life? Yeah. Can I use it to intervene? Can I use it to show other witnesses what we can do? Right? So that's a challenge. I think other challenges are what sort of um, what again capacity. I'll give you another example. We went to Cape Verde in West Africa this year.
Mm-hmm.
Awesome. Too bad we don't have another hour to
Yeah.
talk about
Oh,
that.
I know. I'd love to hear about it.
Yeah, maybe offline we can talk about that.
Okay.
Um, but it was great to see. Well, great. So the point I'm about to make is that they're having similar challenges there, which is
Mm-hmm.
why we were there in the first place, and we were able to transmit, especially CPR skills, to very young people. Kids as young as like 7 we're learning CPR when we were in Cape Verde, um, and our folks got a chance to tour the hospital and talk to local firefighters and just get out into the community. And it can be a little bit overwhelming at times when you realize the scale
Yeah.
of problems that Black people, African descendant people, in particular, but not specific, right? Like,
Yeah.
but in particular, the issues that we have with accessing care at the point of the injury, at the point of the life-threatening situation. And we are going to be looking soon at what characterizes pre-hospital care for Black people, especially here in Chicago. But the more that we talk to folks here in the U.S. and around the world, we see these issues, and one would think that we have a lot of this solved in a city like Chicago, right, where people come from around the world to get their medical training
Mm-hmm.
and to access wonderful resources like the University of Illinois at Chicago to get their degrees. And
Yeah.
we have all these hospitals, but you still have people, dying essentially because of lack of access. You still have people dying because of issues with violence. You still have people dying because of unconscious bias. You still
Mm-hmm.
have these things happening.
Yeah.
And so sometimes the scale can seem just outrageously insurmountable,
Yeah.
you know. But again, the inspiring thing is that people are interested and hopeful
Yeah.
from Chicago to Cape Verde to all around all around the world,
Yeah.
right?
Yeah. I mean, so man, like I said, I do wish we had more time, and I know we're closing in on at the end of it, but I have to ask these questions because I think they're very important for those listening to really understand how much you all are doing and just, but also the realities of things. And so you've mentioned many times, right, like that things are like be overwhelming. You've mentioned even burnout, right? And so I'm very curious as to how have you been able to manage the calling of this work, but also being able to just self-care and like being able to
Mhm.
take time, because it is, and especially for those who are in the clinical realm and are doing things to serve community members that are dealing with so much underserved, under-resourced, and dealing with high levels of mortality rates,
Mhm.
right, for various reasons. It can be very cold. You can find yourself very numb to seeing so many hardships and so many things
Right.
happening. So how do you manage to self-care for yourself and be able to continue to push and remain hopeful?
Yeah, I appreciate that question a lot, especially because I know that this self-care concept is very important, you know. It's very important that we fill up our cup,
Mm-hmm. Yeah.
and hopefully to the point of overflowing with joy
Yeah.
for the life that we've been given and the love that we have. And, it is that, from that full cup of joy and love that we're able to give to others. And it's so important that those of us who are considering health professions, in the health professions, in caregiving roles, and I consider the full spectrum of people that work in healthcare settings to be in caregiving roles, that we really not lose sight
Mm-hmm.
of the human being that is there with us.
Yeah.
I know it's hard. I've been there where people are just so disrespectful,
Yeah.
maybe, right?
Yeah. Yeah.
Or, you know, um, speaking harshly to you, or not even just the level of, one on one. The kind of work environments we're in can range from being very just stressful and you're being overworked. Maybe you're motivated, but you're overworked.
Yeah.
To just being violent workplaces that we have to deal with in the health professions.
Yeah.
And one thing that sometimes the employers and institutions push is self-care, like, oh, well, just, engage in self-care. Well, I mean, what does that look like?
Yeah, exactly.
If I'm working 60-hour weeks, what does that really look like, to just tell me to do self-care? And so I think that's why for us, collective care is really important to talk about, not necessarily instead, but to really put that out as not just, so it's not, so my health isn't just about me, really. It really isn't. It's great that if I can drink water every day and I can exercise, that's great. But if I'm surrounded by people who cannot, if I live in a society where people do not have the same kind of access to the sorts of methods that work for them for self-care, the sorts of methods that work for them to feel better, the sorts of methods that work for them to increase their wellness and motivation and happiness, and to care better for their bodies and look after their bodies better. It's really hard for me to say that well, I'm healthy,
right.
But nobody else is. It doesn't make any sense that I can say that. And so as far as that burnout issue, one thing, again, the thing that actually lifted me up in the moment was collective care, right? It wasn't, me just pulling my bootstraps up.
Right.
It was hearing the impact that the work that I was doing, hearing the impact it was having on the lives of others. Yeah. And people sharing that with me. That was the collective care piece that I needed to actually deal with that burnout. Yeah. So sometimes burnout is about perspective. Yeah. Am I looking at this problem as something that's going to drag me down, something that's going to drain me, or am I seeing it as an opportunity? And what am I seeing it as an opportunity to do? And sometimes I found that if I push through that feeling of burnout to actually, do the thing that involved getting out into the community, getting out of the house, connecting with somebody else, I was actually able to access something that brought me joy. Wow. And so that was a big part of it, is that I was able to continue to find joy in the work that I was doing. If I was not able to continue to do that, it would have been very hard for me to continue, especially volunteer. Now I'm able to get paid for it, but I still deal with those same things now. It's there's some new pressures that are added now. But within our organization, we really try to retain that same sense of togetherness and collaboration and love and unity now as we did when we were all volunteer. And especially as our team grows, especially as the work that we're doing keeps expanding, there's always more to do.
Right.
And there's definitely now more things that maybe we don't want to do but have to do because now we're this nonprofit. And so really working to embed a culture of Ujimaa in the team, and a culture of collective care in the team, and a culture of gratitude in the team, and a culture of values, like we're like being a values-driven organization and not just saying what we think they are, but what are the behaviors associated with our values, and are we doing those behaviors? Yeah. So those are the kinds of things that we're doing to address burnout on the individual level, but also on the level of everybody working together.
I think that's amazing. The fact that you even in turn, right, like you push collective efforts and collective well-being, but then in turn use collective well-being to also uplift yourself, right? So it is a give and take. It is reciprocal, and I love that. And you kind of touched on this. This is my last question. So if you don't have to answer this, honestly, for the air, but because you hinted on it, but I do still want to ask it because I think it might be beneficial or not. But what's your why, right? Like with everything you mentioned, what remains your why?
So when we started the workshop in the living room 10 years ago, me and especially the person who was who was really like the co-founder, we had been talking about doing this for I think 3 years before we actually did it.
Mm.
And one of the catalysts for it was someone dying, and someone who was shot and died in the ambulance on the way to a hospital, and that ambulance driving past multiple hospitals, on the way to another one, right? This particular death was also the catalyst for the campaign that led to the current University of Chicago Trauma Center that's there now, right? So the why was, I want to better take care of my family and my loved ones. So it really started at home. It started at home. It was, there are people that I know they feel responsibility for me, and I feel a reciprocal responsibility for them. What are the things that we should all know? And because we're in Chicago, because we lived in the neighborhoods we lived in, because we are Black people, one of the things that we knew we needed was gunshot response skills. And I had gone to nursing school. I know some things that I need to make sure that other people also know. It doesn't do a lot of good if only I know, or if only people at the hospital know, or if only people on the ambulance know. For multiple reasons. One of them being very practical. The person who's there when the shooting happens has a golden opportunity to just start care immediately, right?
Yeah.
But then, how do we know that the person who's working the ambulance is going to show up, hop out of the ambulance, look at my loved one, and see them the way that I see them? See them as a person who's worthy of the best care. I cannot trust that will happen. I can't. I cannot trust that the person at the ER will see my loved one, with their, brown skin, and nappy hair showing up at the ER. I can't trust that they will see that person and say, yes, I'm going to do my very best for this person because I see them as fully human as I see myself and my loved ones. I don't trust that is going to happen every time, right? But if I can train my family, if I can train my loved ones, if I can train my neighbors, then, I'm increasing the chances that at least one person on that chain is going to do the best they can because of how they see that person. When I look at you, I see myself, and I would save myself. So I'm going to do my best to save you. Yeah. And so that's the why.
Yeah. Yeah. That is powerful. And again, I think that's a strong way to end this amazing conversation that we've had. Miss Martine Caverl, thank you so much. How can people learn more about Ujimaa Medics, and be able to get in touch and support you all if they've never heard of you all or want to learn more about y'all?
Thank you for asking that question. So one way is to go to our website, www.umedics.org, because if you go to that website, sometimes we publish events you can sign up for. And also we have our workshop request form linked on the website. You can click on the link that says request a workshop, and it will give you a few options as it relates to what kind of workshop you're interested in, or I'm not really sure what kind of workshop, I just want to connect. You can fill that form out. You can also follow us on social media. We're most active on Instagram right now. So you can look us up at Umedics Shy on Instagram. And if you have any general questions, you can also email us admin@umedics.org, and that will automatically add you to our mailing list.
Awesome. This has been amazing. Again, Martine Caverl, Executive Director of Ujimaa Medics, also known as U-Medics. Thank you so much for leveling with us on the community level, and we look forward to hearing and supporting all the things that you all are doing now and beyond.
Absolutely. I appreciate being asked to come. Thank you so much. This was great.
Yes, thank you. So that's going to conclude this episode, the very first episode of many more to come here on the Community Level Podcast. It's been such a pleasure. Special thanks to Martine Caverl for joining us and talking about her story, speaking about the work that U-Medics does. And one of the key things that stands out to me is the idea of hope. And we here on Community Level Podcast are very hopeful about the great things that are in store for you and us. And we are very excited about the stories that we can bring that can unify all aspects of people who are invested in community health, communities, leaders, scholars, activists, practitioners, policymakers, all of the above. We're very excited about being able to all meet on the same level. As I said many times before and many times again, we will be dropping episodes on a monthly basis, so please be sure to subscribe. Be sure to turn your notifications on and just follow us wherever we are, and we'll be able to bring to you these amazing stories. Also, be sure to check out our YouTube page where we'll be having those videos up for those formal presentations, more your presentation styles, and that's where you can be able to ask your questions, and we can be able to bring those questions to our guests so that they can be able to respond and share a little bit more light about a lot of the work that they're doing and whatever it's a research project or whatever the case may be. So it is an honor to be able to serve as your host. I look forward to many more episodes ahead. Until then, my name is Dr. Kalechi Bay Lamberts, and I look forward to talking with you next time right here on a community level. Take care.
Thank you for tuning into Community Level. If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with others. Join us next time as we continue to explore the intersection of research and community action. Until then, stay connected and stay level-headed.